What does oral DNA saliva sampling do? Stick around and find out. Hi, I'm Christina. I'm the lead hygienist here at Dublin Dental Care. Welcome to our Dental Hygiene Wednesdays. I want to thank you for taking time out of your busy schedule to stop by and watch this video. Every week we like to cover a different topic or a different product that we use in our office, and we like to go over why we use it or why we do what we do and how it's beneficial for our patients. That way they can understand why we recommend what we recommend in our office and why we do what we do. Last week we talked about the intraoral camera that we use with all of our new patients and even some of our older patients. We discussed what it's used for and why it's used, what type of pictures we take on it, and we actually demonstrated it on our lovely assistant Mallory, who is not with us this week. If you missed that video, you can check it out. It is still on our Facebook and YouTube pages. Feel free to go back and watch that. This week we are talking about oral DNA and saliva sampling and why we use it in our office and what it is actually used for. So oral DNA saliva samples are very useful, and we like to do them on our patients that we bring in and have either our new patient that are diagnosed with periodontal disease or possibly an old patient that has been coming in and has active periodontal disease again. So what we do is we take a sample of their saliva and we send it into a lab. There are actually two different types of tests that we do. One test for what the likelihood is or how high of a risk you have of developing periodontal disease. And the second one tests for what type of bacteria are actually in your mouth and different ways to treat them, or the best way to approach for treatment. So it definitely is a great tool that we can use to help treat periodontal disease and make sure we're taking care of every type of bacteria that there may be in your mouth. So I'm going to actually demonstrate how it is done and then go over what the tests look like and how they read out for the patients. So I'm going to demonstrate the actual saliva sampling collection. We have these solutions that come in the kits. It is a saline solution that we have our patients rinse with for 30 seconds and then gargle at the very end and then spit into a tunnel or a tube, and this is what we send to the lab. So I'm going to demonstrate that for you today. So you twist off the lid and then you're going to take all this and put it in. And once that's spit in, you twist this lid on, and then we will put the patient's name and information on so that the lab knows who to reference this to. It's important to make sure that you have the patient gargle at the end so you get the bacteria that's even at the very back of the throat. So switch for 30 seconds, gargle at the very end, and then spit into the tube. So once we collect your saliva sample and we send it into the oral DNA labs, they test it and then they send us back your test results. So we get those through their website and we can check them and we will download them and print them for you to take home to look at. So this is a first test. It shows the likelihood or how high of a risk you are of having periodontal disease. It shows all the different types of bacteria that are associated with periodontal disease. And then all of these black lines that are on here are the therapeutic threshold. So we're wanting them to be below those lines. If you have bacteria that were in your mouth, it shows up and then it'll show you whether it was above or below the lines. And then underneath, it shows you what each pathogen is that was showing up in your saliva. And then it shows whether it was high or low or medium. And then along with that, it tells you the clinical significance of that bacteria and how it, helps or causes your periodontal disease to progress or where it's seen clinically in the mouth. So this is the first one that tells you how likely you are to have periodontal disease. And the second one is very helpful when it comes to actually treating periodontal disease. This shows you, again, the bacteria that's present in the mouth. And then it also helps us by telling us different ways the bacteria should be treated. So if it can be treated with just scaling or root planning, if there are certain antibiotics that we should be sending the patient home with to help fight off the bacteria that are in the mouth, because there are certain bacteria that are present with periodontal disease that scaling or root planning won't take care of. So this is nice because it lets us know what type of antibiotic will help us fight this bacteria and get it out of your mouth. Then it also shows you home care and then the reassessment that is needed for you as a patient to get the best results. So these are great tools to use in our office, especially if we have a patient who has had periodontal disease and it's come back and is active again. Not come back, but is active again in the mouth, and we need to retreat. So this kind of helps us make sure that we're covering all of the bacteria in the mouth and making sure we're getting rid of it with one treatment. So definitely important to have these. I want to thank you for joining us this week on Dental Hygiene Wednesday. Feel free to tune in every week. If you have any questions or comments, or if you want to like our video, feel free to watch it on Facebook or YouTube and leave those comments. And if you have any questions for me, you can email me at Christina@DublinDentalCareOhio.com, and feel free to check out our webpage, DublinDentalCareOhio.com. Thank you and have a great week. Hi guys, here at Dublin Dental Care this quarter we are giving away a gas grill and accessories for our referral program. We want to thank you for all of your referrals. It is the best compliment you can give us for the work we do here. Don't forget, along with the entry into the drawing, you will get some sort of gift card for referring any friends or families you may have. So send your referrals on over and hopefully you win that awesome grill package.